Hello, I'm Dr. Helen Consanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to look at a condition that affects millions of people, but is still often misunderstood. It's called fibromyalgia. It's more than just plain fatigue, brain fog, and an invisible burden that you may be carrying in silence. We're going to talk about what it is, what causes it, how it's diagnosed, and the promising treatments that are helping patients take their lives back. And we'll hear the story of one woman who refused to give up, found relief through modern and holistic approaches. Joining me today is someone I deeply respect, a pioneer in regenerative and integrative medicine, and someone who brings both heart and science to every case. Please welcome Dr. Bryn Henderson.
Well, thank you.
Well, let's start at the beginning. Dr. Henderson, what is fibromyalgia exactly?
Fibromyalgia is a long-term condition that causes widespread pain throughout the body, along with the fatigue, sleep problems, and trouble thinking clearly. What many people call brain fog. It's very common with fibromyalgia. What's tricky is that it doesn't show up on a routine test. So many people often go years without a correct diagnosis. It's like the volume knob on your nervous system. If you turn it up too high, everything gets staticky and the pain's more intense, even when there's no visible injury or inflammation.
All right. Well, I've had patients like that, and they were very frustrated. In the old days, they used to think it was caused by the Epstein-Barr virus. Is that still true, or we've got new causes and we've gotten rid of the Epstein-Barr virus?
It's associated, but there's no single cause. In fact, it's triggered by many things, like viral infections, like an Epstein-Barr, but emotional trauma or even long-term stress can do it. Genetics played huge role. If someone in your family has fibromyalgia, your chances of developing it are higher than if not. And then there are deep factors we're still learning about, like how experiences in the womb and early childhood set the stage for chronic pain later in life.
So it's not just in their head.
That's right. It's absolutely not just in their head, because although it's a common myth, these patients are truly suffering. Their nervous system is processing pain differently. It's very real, and the impact it has on the daily life is huge. We need an approach that is compassionate as well as scientific.
All right. So, what are some of the most common symptoms people notice and should seek help about?
Pain. It's widespread. It aches here, it burns there. Sometimes it's even stabbing. So look at all the variances in the type of pain they have. And it often starts in areas like the neck or the back or the shoulders, and then it spreads. And people also feel exhausted, and no matter how much they sleep, they don't sleep enough because they're not waking up refreshed. They may struggle with focus, memory, this brain fog stuff. We see that in our brain mapping all the time. And many also have migraines and, as is usual, gut issues like irritable bowel or anxiety and depression. Either way, they have complex patterns that are very difficult to put a finger on.
Well, let's get specific. Let's talk about one of your patients that came in and had chronic fatigue or fibromyalgia. What did you do for her?
Well, a little background. She was a 44-year-old female who had been in pain for over 3 years, started after a bad viral illness and a period of high stress. The pain was everywhere, shoulders, neck, hips, even her hands. And she felt very stiff in the morning with foggy thinking during the day and became exhausted all the time. Over-the-counter meds weren't helping her, so she struggled at work and struggled to care for her family.
So what did you do to treat her?
We started gently, low dose amitriptyline for sleep and pain, and light walking for exercise. We had already thought of the pregabalin like Lyrica can help with nerve pain. So she began a physical therapy, and we worked on her sleep habits because we had the benefit of the brain mapping, and it showed a very low delta. And as she progressed, we introduced regenerative therapies that included some intravenous therapies, some PRP injections, some regenerative cell therapies, and peptides. The peptides that helped her the most were the BPC 157 and the thymosin beta 4. And the infusions with NAD plus and glutathione with high vitamin C gave her energy, reduced her inflammation, and slowly but surely, she improved a great deal.
All right, this is a lot to take in. We got to go back. All right, so you gave her a prescription for amitriptyline for sleep and pain. How does amitriptyline work for sleep and pain?
It helps depression, and it also helps in terms of the receptors for pain. So you sort of have a double whammy improvement.
Okay, now you give her Lyrica.
Lyrica, like the other gabalins, work on nerve pain mostly and helps with the myelin sheath that goes over most peripheral nerves.
Okay, then you said we're going to do PRP, but where do you inject? She has pain all over her body.
That's a good question because PRP can be specific and also include a concomitant therapy with cell therapy, and that's very beneficial. But the big ticket here are these peptides. Those are inherent in our bodies. Those are proteins. And when two proteins come together, of course, a protein is made of amino acids. So you take these two proteins and they are able to impact within hours, for sure, a day. And that you will know immediately if they help the patients with fibromyalgia. And then the other, so let's say it did, and you want to get some anti-inflammatories in them. So we just talked about the IV or intravenous infusions, NAD plus, glutathione, and high dose vitamin C are typically very good at helping their energy and reducing their inflammation.
All right, let's talk about NAD plus. It's all over the internet. It's all over Instagram. Every day I get like 5 ads about NAD. You can't use this kind. You can't use that. This is bad. If your doctor's giving you this, it's the wrong one. Mine is the best one. Yours is the wrong one. Explain what NAD is and why they're being bombarded with ads to buy NAD right now, all over the internet.
There were some studies that showed that NAD plus was very, very favorable. In fact, it's probably one of the backbones of anti-aging. And that is why, with its strong antioxidant facets, why it's so ubiquitous almost. It's all over the place because it's an anti-aging supplement. It's very good infusion.
Can you take it orally? Because they're pushing it to take orally.
Well, anything taken orally is going into the liver. It's going to be broken down before it even hits the gut, and then it's going out the kidneys. So the answer is, yeah, I've had about a third or less than half the strength you get when you're getting an infusion. So it's a question of value. What's the bang for your buck?
Yeah. So when you give the injections to the PRP, are you adding hyaluronic acid like you do with the other inflammations?
Yes, especially if your target is a joint. Because remember, that is a lubricant.
Okay. All right. So you talked about IV therapies. I'm very into IV therapies. I've seen them work. I like them. I wish every doctor had it in their office, but unfortunately they don't. You do. So let's talk about some of the IV therapies that you would give anybody with fibromyalgia, because as you say all the time, it's not a one-size-fits-all situation.
Well, there's facets of intravenous therapy that's very strong in terms of fibromyalgia. Magnesium comes to mind because it helps with the muscle cramps. And the various vitamin B vitamins, they're all water soluble. And so if there's any excess, you just void them out.
Yeah.
The antioxidants we alluded to and vitamin C and NAD plus are very, very helpful there.
So this woman, how did she go out of your office kicking up her heels and saying, I'm healed and thank you, Dr. Henderson? What happened?
Well, she was ready to dance.
She was.
Yeah, it was a lot of fun. I teased her a little bit, but we combined Eastern and Western approaches. And so sometimes the acupressure points, like in this case, SP21 and LI11 are very helpful. And that trigger point therapy works well with kinesiology as well as physical therapy. It's a very calming approach to the nervous system, which is why it's so popular in the Eastern cultures. Acupuncture and acupressure are very, very successful.
Oh, that is nice to hear. And lab tests?
Lab tests are always going to show inflammatory. And so your SED rates and your C-reactive proteins and things like that will be elevated. And sometimes, if they're not elevated, if they're normal, then many people question the diagnosis.
Okay. So we know that people can get better. That you've proved by just talking and giving us that example. Most of the people, they've had it for a long, long time. So how long did it take before she actually had some improvement?
She went to other physicians before she came to us, and then we realized this is pretty complex. And after a year of treatment, she had a 75% improvement in her pain.
Wow.
And she was able to return to work.
Wow.
And so she's not completely symptom-free. I'm not saying that, but she sure feels like herself again.
And especially that they can get their life back and get to work and not be at home crying their eyes out. So what message do you want to give to someone who's listening to us, struggling right now?
I tell them, you're not imagining this, and you're not alone. Fibromyalgia is very real, and so is the pain. So we went to help you. There's good potential for healing, and with the right care and the right support, if you're consistent in your steps, you can absolutely feel better. So we even developed a mnemonic for it. It's called Fibro Hope.
All right. What's the F stand for?
Follow a routine.
I.
That include gentle but consistent exercise.
B.
Is balance, activity, and rest.
R.
Relaxation techniques.
O.
Optimize sleep.
H.
Is a healthy diet.
O.
Is open up about symptoms. Explain them.
P.
Is pain management.
E.
Is emotional support. Every small step matters because every day is a chance to get closer to being healed.
All right. Well, I've learned a lot. I didn't know that you could use PRP, exosome stem cells for fibromyalgia because in my day we did other things. But now we have cutting edge techniques and I hope you will seek them out. A huge thank you to Dr. Bryn Henderson for sharing his expertise and reminding us all that healing can happen. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.